Hey folks, Dr. Gerstmar from Aspire Natural Health. In this quick video, I want to talk to you about a pair of studies I recently reviewed talking about the use of acid blockers in young babies. Now, the routine use of acid blocking drugs in very young babies for symptoms like fussiness, spitting up, or unhappiness around feeding has become a relatively common thing these days and something I'm honestly not that comfortable with. Now, before we go any further, let me just say I'm not anti-drug. I believe there's a time and place for basically all therapies, but I think we're way too cavalier about the use of these particular drugs in everyone, but especially in little babies. And the pair of studies I'm going to talk to you about now highlights that fact. Okay, the first study was a double-blind, placebo-controlled study. So this is the gold standard study for medicine, using an acid-blocking drug on the one hand and a placebo on the others in babies who had GERD, or as many people know it, heartburn. And what they found was that there was no difference between the babies getting the acid blockers and the babies getting the placebo. That's right, so no change in fussiness, in spitting up, or in trouble around feeding, but they did actually find one difference, and that was that the drug increased the risk of babies getting lung infections. That's not a good thing, and it is unfortunately consistent with other data we've seen on the use of these drugs. Folks, the acid in your stomach is actually protective. Yes, it can cause problems for people, but it's not there for no reason, and getting rid of it can cause problems, one of which is an increase in the risk of infections, both in the gut and in your lungs. So look, this study showed us that placebo, which is basically nothing, was as good as these drugs for the treatment of GERD in babies, which is to say doing nothing in terms of these drugs is just as good as giving one of these drugs. So they don't actually help, and they have been shown to cause harm. Now, the second study that we'll mention found that giving kids acid-blocking drugs or antibiotics to kids that were younger than 6 months old, so giving antibiotics or acid-blocking drugs to kids who were younger than 6 months old significantly increased their risk of getting allergies, asthma, and eczema later in life. And the thing that was increased the most was actually food allergies. So, could the use of these drugs be one factor, not the factor, but one in the increased risk we see of asthma, allergies, and food allergies going on in our children these days? And I think the answer is yes, it is one factor. So please don't beat yourself up if you were told by your doctor to give acid blockers to your baby, or you had to give antibiotics to your baby for that matter. Sometimes these things really are necessary and should be used, and you made the best decision that you were able. I mean, a doctor told you that this was the best choice, right? But having said that, if you're in a position now to make this decision, having seen this video today, recognize that the vast majority of the time, I would pass on giving acid blockers to infants or most anybody else for that matter. They really do have potential problems. If you'd like to look at the studies that we've talked about in this video, they'll be posted along with this video. And if you'd like to get a guide on how we treat people with GERD or heartburn without the use of these drugs, all you need to do is fill out the short form that's going to be below, and we're happy to send that to you for free. So please click down below and we will send that right to you. So there you have it. Please don't give acid blockers or antibiotics to young babies unless it's absolutely essential to do so. Not only do acid blockers not really help, they cause harm. At Aspire Natural Health, we are experts at treating digestive issues and autoimmune diseases. If that's you, we'd love to connect. We offer a no obligation, no pressure chat to see if we can help you out. If we're the right fit to work together, we'll move forward. And if we're not, we'll do our best to connect you with a person who can best help you. You have nothing to lose, so please call us now at 425-202-7849 or email us at info@aspirenaturalhealth.com. All right, folks, until next time, take care.